live. It's ThinkTech Talks. It's Community Matters. It's Friday, too. It's 1 a.m. I mean, we did that yesterday with Europe. It's 1 to 2 p.m. block. And we have Kelley Withy. Kelley, I got, but Withy, I want to spell Withy. All right? And she's at the medical school. This is an important discussion about healthcare workforce shortage. And is it worsening or what? And Kelley is a professor of what? Alternative medicine at the medical school.
Mm-hmm.
What is alternative medicine?
Oh, it's everything out there that's not Western, so it's big. I'm a family physician by training, though.
Okay, it's close to that. Who do we have? We have Dr. Turkson. He's from the UH Cancer Center in our program last week with Ginny Pressler and Hawaii Pacific Health. And we had Dr. Charles Rosser. Is he yours?
Not mine.
He's, okay, Turkson talks about all these kind of nutraceuticals that will help you and against cancer. And Charles Rosser is really in the same place. There's a lot of research going on. That's what we found. We had 5 researchers and HMSA. So he watches the researchers.
Well, there's a whole new building. The Cancer Center just went up like that.
Yes, it did.
Yeah.
I mean, well, it was a coiled spring.
I guess so, but it just appeared.
Anyway, so what provoked the show, Kelley, was a press release that Tina Shelton, who is your PR person at the John A. Burns School of Medicine, sent around just this morning. And I talked to Kevin Rogers there, in the communications department. And
he's at AHEC.
He's
in
what?
my office. He's mine.
Okay. And we found that there's an issue about whether the workforce is dwindling in healthcare. And I wanted to pursue that with you. It's an old issue. I'm talking about it for years, really. Senator Josh Green comes around here every Tuesday. He talks about it once in a while, at least. He's kind of a victim of it because he's from the Big Island and all that. And I wanted to compare notes with you about how that headline, emerges and what the data is, what the discussion is. And furthermore, you're going to have a summit. Gee whiz, that's coming soon. Tomorrow, about this very issue, about the data and how it affects jobs and number of doctors available. So tell us how this all comes about.
Well, you asked about healthcare supply dwindling. And yes, I would say the answer is what we do is we look at the physician portion of that. So in 2010, we started looking at this, and at that point, we estimated about a 600 physician shortage compared to a population similar to ours on the mainland. Since then, it's actually increased to over 700. This year, we found that we have right now 2,795 full-time equivalents of practicing physicians. And actually, the estimates we've been provided by national company say we need 3,437. So, over 700.
That number is sort of an ideal number. That would be sort of nirvana here.
No, not necessarily. That is what the average community on the mainland that has our population size, age mix, obesity rates. They don't do a very good ethnic breakdown.
Okay, but that's not necessarily the ideal.
It's
the
not
ideal,
the ideal
could be more.
Yes, exactly.
Is more.
Yes.
Okay.
And that doesn't take into account that we don't have as many physician assistants and nurse practitioners as most communities do. So we're probably at more of a disadvantage than the rest of the country. So yes, that could be a low estimate.
Footnote to that, forget where I saw this, but it was on, I think, educational TV. It was about a thing called the Health Wagon, and it was in Arkansas. And these were advanced practice nurses driving around this old converted Winnebago through the hills of Arkansas and trying to help people. And there were no doctors involved at all. And I said to myself, this is, whatever happens in Hawaii, it's just better than that. And what we have here is sort of a transformation, not necessarily a good one, of delivery of health care in rural areas, in areas that have no money, no insurance. These guys, they give chickens for their health care. That's what happens. And, it's a little scary, But it sounds like it's an indicator of sorts, and maybe somehow it's in the conversation here.
We have some of that here.
Yeah.
We have Caravan. Waikiki Health Center has a Caravan. The medical school has a program with the medical students, but they're supervised by a physician. They're all collegial with a physician, but those are actually very practical ways to care for the homeless because you go to them. And so we do have some of that here, and it is helpful for different populations.
You're caring for the homeless. How nice of you.
The medical
You didn't have
school
to
is.
do that. You didn't have to do that.
Well, I quit medicine last year, so I'm not caring for anybody. Barely caring for myself after putting this conference
One step
on.
at a time. Right.
Yes. But things that we have found from studying the physicians, so we have them do a voluntary survey every year, and then the people who don't answer our questions, we call up their offices.
Good.
This year we found that 93 we confirmed retired in the last 2 years. 97 we confirmed moved to the mainland or elsewhere. And then...
These are practicing doctors moving to the mainland, not retired. So they've been
some are
taking
retired.
themselves out of the local workforce.
Yes.
Okay.
93 have retired or died. 97 have moved physically out of state. Then there's 300 that we can no longer find. Their phone number doesn't work, they're not online, we can't find them.
Any guesses? Qu'est-ce que c'est que ça?
Well, they probably moved or retired.
Yeah.
So, and we've confirmed 176 new docs, probably 20 to 40 additional new docs that we just haven't been able to find yet. So you can tell we're losing more than we're gaining.
It's a net loss. You can do the math.
And it's going to hurt. It hurts now, especially if you're on neighbor islands, especially the Big Island. If you're looking for a doctor, it's hard to find. But even in Honolulu, if you're an 18-year-old who's seen a pediatrician happily your whole life, and you need to find an adult doctor or a family doctor.
Not so easy.
Not so easy. So a lot of pediatricians are turning into adult doctors because they have to.
Be nice to your doctor.
Yes.
Because if you lose your doctor, if he gets mad at you or you didn't take his advice, and he tells you he's not going to see you anymore, you're going to have a problem filling that buka.
Yeah, and don't let your doctor retire. But honestly, when I talk to audiences and they say, what can we do? The first thing I say is thank your doctor. It's easy, it's free, and it feels really good. As a doctor, that's why you went into it, to help people.
Yeah.
So, that's an easy way. We've even talked about getting bumper stickers that say got doc. It's just
what does that mean?
Like got milk, got doc. I don't know. Okay, maybe it won't work. But to raise the awareness of it, because we are losing more than we're gaining, and we're not training enough. So,
I remember my surprise at I called it the groundbreaking, back in 2001. Was it? What's his name? Ben Caetano was just leaving office. Lyndon Lincoln was coming in office. They had a groundbreaking over there, and it was quite remarkable. It was pretty exciting, actually. And I found that there were going to be 66 seats in John A. Burns School of Medicine, which was precisely the same number as had been in the previous iteration of the John A. Burns School of Medicine. For some reason, it was like Route 66. That number has an iconic value to it. And now today, 2014, 13 years later, how many seats?
66.
Got it.
But 10 years ago, there were only 56.
Okay, sorry.
So we have increased. The new goal is 75. But in order to do that, we need more doctors to teach our students, because we depend on the community. We don't have a hospital. We have lots of hospital partners that are wonderful, but we need students out in the community learning things. You don't want your doctor you don't want to be in the hospital, so you don't want your doctor to train everything all the time in the hospital. You want them to train in the community.
But in other communities, Kelley, the hospitals are training hospitals, right?
Yeah. Our hospitals are all training hospitals.
So the doctors, some of them anyway, come from the hospital.
They all train some in the hospital, but we need more training in the community. And I don't just mean Oahu community. I mean Kauai, Molokai, Maui, Lanai, Big Island.
Yeah.
We need more docs to step up and say, I want to train. And they do. They want to. So then we just have to get the students there, so we raise money to be able to fly them there.
I'll give you an idea. They could come here at this table.
They could.
And we want the lawyers to do this too. And they can talk medicine. update on the latest and greatest. I think my next question, by the way, is going to be, why is all this happening? But one thing strikes me is that medicine is technology, and technology moves so fast. And you get out of medical school, you think you have the knowledge and the skills, and 3 days later you find out that you've been eclipsed, and there's something really major happened, and you didn't catch that in medical school, and you better find out right away, or else. And so that happens for a whole career, and it's a burden to stay current. And so training is really important on all levels.
And training how to get the update of the information.
Yes.
That's actually the most important part.
Yes.
And that's because half of the things I learned in medical school are completely different.
Yeah.
They've reversed them completely.
It's not only eclipsed, it's turned around 180.
Yes. Oh, what we taught you was completely wrong. Don't do it. So
That's scary.
yeah. So you really have to keep up with things. And one thing I love about our medical school that's problem-based learning is they have to look things up from day one. So instead of being told, the way I was, it's a great way to learn, but I was told how the heart works, the lung works, how everything works, and then after 2 years of that, then I had to go and learn how to ask the patient what they're feeling and get out of them what it could be. So it's a different process from learning organ systems to listening to you.
Interactive.
Right, so from day one in our school, the students are having to piece things together. They get a piece of paper that says you have a 65-year-old female, Caucasian with a cough. That's all they get. They have to think, well, what could cause this, and what do I need to know?
The power of diagnosis.
Yes, and so they're using they're creating the neural pathways they're going to need.
True.
And then they go home and they have to look everything up and they have to teach their classmates. And so they know where to find stuff. So I really like that about our system. But we're digressing.
Yeah, well, it's okay. Digression is okay. I mean, what about House? Where does House fit in all of this? What I love about House is what you call it, the neural pathways, or not, as the case may be.
Well, the one thing I can tell you about House is you can't tell a patient to go, what himself. You can't do that.
It doesn't work.
But I think any doctor who's watched that has said, oh, I want to be able to do that.
Yeah.
And you also don't have a team of 6 that dedicate all their time to one patient.
Stand around, watch you.
Right. So, the House is amusing, but I wouldn't say it's realistic.
No.
Now, Scrubs.
Okay, go for it.
Scrubs is, has a little more realism to it, maybe because there's so many frustrations and things, you want to go through, but it doesn't actually deal with the medical part very well. But they are amusing. But they've changed. We used to watch Marcus Welby or Dr. Quinn, Medicine Woman.
Ages,
right,
ages.
But the kind of doctors we have, you can see, have completely
yes,
changed.
You see how they changed.
They're hospital-based now as opposed to in the community. Where do you want to live your life?
As a patient, or?
Yeah, as a patient.
Actually, I want to live my life, and we can talk about this later.
Sure.
On the internet.
Oh, virtual life.
Virtual medicine. Okay, we'll take a short break. That's Kelley Withy, Dr. Kelley Withy, Professor of Alternative Medicine at John A. Burns School of Medicine, kind enough to come down and talk to me about the healthcare workforce shortage. We'll be right back after this short break.
Aloha, hello. My name is Hong Jiang, and I host ThinkTech Asia every Tuesday afternoon at 4 p.m. At our show, we talk about issues that are important in Asia, such as environment, culture, history, religion. We broadcast live, and we're also on Olalo 54. Make sure to tune in, and we'll see you there. Thank you. Goodbye.
Okay, we're back. We're live. We're at ThinkTech Talks. Community Matters here on Friday, 1 to 2 block. And we're talking with Kelley Withy, who is a doctor at the John A. Burns School of Medicine. She teaches alternative medicine, and she's here to talk to us about a program that they are doing tomorrow in Waikiki. I guess it's a big conference type of program about the healthcare workforce and other things. So Kelley, you have some numbers you want to share that could come out tomorrow.
Well, I do have the calculations of the specialties we're most short of. So we need 300 more primary care providers. Family docs, internal medicine, pediatricians, gerontologists. We need 300 more of those statewide. We also need neurologists, general surgeons, infectious disease specialists, brain surgeons, heart surgeons, radiation oncologists, lung doctors, heart doctors, and gastrointestinal doctors. And most of those, we need twice as many as we actually have. So we need to double the supply of those.
This is scary for an ordinary patient person like
yes.
myself.
Well, luckily you're in Honolulu, and most of our hospitals are here in Honolulu, so we have a better supply than the rest of the state.
Why are we so down?
Well, we already said we don't train enough.
Okay.
But...
I mean the profession in general. I suppose NOI too.
Well, there are, ebbs and peaks.
I mean, I've heard doctors talk about, oh, gee, Medicare and the paperwork, oh, it's so hard to make a living, and all these demands, and then the lawyers hanging around on us, and we have all these people, and we have more challenges now than we ever had before. There's less gratification. I'm out of here.
Yes.
That's what I've heard.
I heard a statistic that 90% of doctors fantasize about having another career. And yes, I have.
Well, you are, kind of.
I am. I'm doing teaching, education, research now. But yes, it is much more frustrating than it was even 10 years ago. We have, and I actually had a high school student do a project. He pulled all the prior authorization forms for insurance companies in Hawaii. There's only 8 insurance companies. The stack was this high of forms a doctor needs to know how to fill out.
In the ordinary course of practice.
If they want to get everything for their patients, they have to know, And usually the nurses will fill part of that out, but they're all different. So that's a frustration. And then there's going to be cuts to payment if you're not board certified, if you don't have your electronic health record up to snuff, if you don't do electronic prescribing. There's all these new cuts. Plus, there's regular Medicare cuts that are supposed to balance the budget, which cut the doctor's Medicare payments 30%, and they get reinstated. Anyway, I could go on.
Coding is so risky.
Coding, I could go on forever, so I won't.
Okay.
But it's very frustrating right now.
I want to be sure that Marcus Welby never had these problems.
He got, like you were talking about chickens in return for, he got respect and adequate, support. He didn't drive a Porsche. I never saw his car, to tell you the truth. But he took care of that community, and we've gotten away from that.
Yeah, we have, and we've gotten away from the personal aspect. But I think what's interesting now, and I don't know how much contact you have with this, but HMSA came up with this program, courtesy of some very smart entrepreneurs who came to town and sort of developed the program. Where you could get on the internet and you could talk to either your own physician if you wanted to be in the program, or some other physician, and ask questions in the middle of 2 o'clock in the morning. Ask questions, and I heard about it. We covered it here on ThinkTech for a while, but then it seemed to disappear, and I think it disappeared because not enough doctors wanted to participate. But that's a guess. So why can't we do that? Why can't we do that? Isn't that helpful in the context of not having enough doctors?
Well, did you ever use it?
No.
Okay, but let's look at that technology, and let's see, if you lived in Hilo and you needed to have a visit with a specialist that they don't have there, if you could go on your computer and you could visit with that specialist, would you like that?
Yes.
Yes.
1,000 yeses.
And that's telehealth, and we really want to build up telehealth. Alaska has an excellent telehealth system. We don't. So that is one thing we're working on.
Yeah.
And that actually the Rural Health Association, Hawaii State, is making that a priority for rural areas this year. So,
well, we are rural because we're separate islands, and you know why
right.
there's no super ferry.
That's right.
To put it in a word.
I know. I love the super ferry.
But so if tell us how it would work. I mean, in the ideal sense. So we had enough people, we had enough technology, we put enough money into it. The establishment got behind it, including HMSA. So, which I think would actually, they would like to see this. How would it work? I wake up at 2 o'clock in the morning. I got a problem with my Zorch. Okay, what do I do?
So you have a group that takes care of you. You could call them up and say, these are my symptoms. Probably be a nurse line. They'd talk to you. If they thought it was severe enough, they would hook you up to a doctor.
They'd be awake.
They would be awake.
Waiting
they would
for
be
my
everybody's
call.
Everybody's calls.
I'd see their faces. They'd see
you
mine.
You could. You'd
And
probably
they could
just
look
call
at
on your
me.
phone at first.
They could notice I was distended, for
Yes.
example.
If you were chronically ill, they may have some equipment in your house like a scale to see if you've gained weight, like a oxygen meter, like a stethoscope even. They have all that technology. They'd have it in your house so they could monitor you remotely. So
Sounds
anyway,
better all the time.
it sounds good. But I would even like to be able to text my doctor and say, hey, I've got that thing again. Can you know, we can't now. You know, doctors don't get paid unless we see you face to face.
This is a big problem, and it's actually what I would call silly.
But we won't go into that because I could talk about that forever too.
Okay.
But you asked me a question about what would now I forgot to. But
Well, how would it be in the perfect sense? What would the experience be?
Oh, the experience would be you would get an answer right away, and then if you needed to be seen, they'd tell you where to go. You know, if the video thing didn't work,
Yeah.
and you would feel secure that there was somebody
Somebody you
get
could
help
talk
from.
to.
That's
And
the idea
that's back to
behind the
Marcus
medical home.
Welby, because there's this. It's more than just
Yeah.
that they're answering the question.
Right.
It's that somebody out there is tracking you, following you,
knows
cares
everything about you. It's
Yes.
like the patient-centered medical home, I like to say, is like the show Cheers, where everybody knows your name. They've got you go in there and they welcome you. They've got all your information. They know that you have diabetes and that you go see this person and that they know your report back from here and they have all your stuff. It would be great. And they're available to you all the time.
Yeah.
And you can go online and contact them and make appointments and you know.
It's got to go this way.
It will.
I don't know why we fool around with these 2,700-page bills in Congress when we still haven't gotten medicine on the internet straightened out.
Well, yes. But it's slow progress, but we're working on it.
Okay.
And yeah, technology is not as advanced, I would say, in medicine as in other areas.
Yeah.
We still use the fax machine. I hate the fax machine. Oh my gosh, the fax machine.
Yeah.
Anyway.
Yeah, okay. Oh, no,
Anyway, the
it's a word
conference
to
this
the wise,
weekend,
yeah.
this tomorrow.
So tomorrow, how did tomorrow get started? What is it built around? What's going to happen?
Okay, so I told you we do a survey of the physicians every time they relicense. They pay a little money, and that started 4 years ago. And so with that, we hold this conference every year. We do the research. We have some other projects I'll tell you about. But this is a continuing education conference that's free to all the doctors in the state. They already paid, so it's free. It talks about the changes that are going on in medicine and different models of practice. And there's one you would really like to hear about, but we don't have time right now, which kind of bypasses a lot of the paperwork.
Making me curious.
Yeah, I know. We don't have it here yet, but one of our speakers is an expert in it. So there's new models of care that are going to be talked about tomorrow. But we're tacking on some other things. This is the fourth time we've had this conference, okay? And it's getting bigger and bigger. So
They come
this
from
year,
other places to attend?
the neighbor islands.
Oh, perfect.
All the healthcare providers on neighbor islands, we give them same-day transport for free to get them here. And the conference is free.
From Maui?
Yeah.
What happens if I get sick on Maui tomorrow?
Well, hopefully there's a doctor covering your doctor. But yes.
Okay.
Okay.
Never mind.
So we're doing a couple other things at this conference. We're getting educators to come in the morning, and we're writing a book, A Health Careers Highway. It's got resources on every island for students who are interested. It's got a listing of all the potential health careers. It's got information on how to get scholarships, et cetera, et cetera, et cetera. So we're hoping to make a single resource that we can convert to a web page where it's a one-stop shop for anyone interested in health careers. So say you want to go to medical school.
I do.
What do you need to get into medical school?
About 50 years more in my life, but never mind.
Well, hey, that's modern technology, modern medicine
It's
can give you
happening.
that, right? But you would want to know, should you do research? Should you do shadowing of doctors? How do you apply? Where do you apply? So we have resources like that all in one spot.
This
so
is
you know
great,
where to go.
because a lot of kids, it's traditional, it goes way back, think they can't do that.
They
It's
don't
not
even, it
available
doesn't occur to them.
Hasn't occurred to them.
And do you know there's 300 different health professions? Kids usually know doctor, nurse. No, there's 300 different health professions, and they almost all need people.
Very gratifying, very challenging, lots of technology.
You can get
growing all the
right.
time.
You can enter the health field in 6 weeks after high school. You can be a certified nurse aide, and you can work, and then you can work up. You hear about career ladder programs. You can work your way up from there. So anyway.
Footnote, sorry, I do footnotes. Ebola is so scary because the healthcare workers themselves
They're
are
dying.
at risk.
They're dying.
And dying.
Yeah.
And, you know, I mean, I think this is actually going to generate a whole new look at healthcare providers to make them safe. I mean, we don't want them to die. They've got to be made safe.
And even the usual universal precautions are not saving them.
Yeah, so there have to be new precautions. It's not only Ebola, you know, as you go forward, there'll be other things. We have to be, you know, into infectious diseases these days. The world is too small a place.
So the other thing at this conference tomorrow, which is free, you can come to the Hilton Hawaiian Village, Coral Ballrooms, Coral Foyer. We're having a job fair in the afternoon. So health career
It's part
jobs.
of the same conference. That's
same
great.
Conference.
Yeah.
Saves money that way.
Okay.
So we're going to have 23 different booths. Not all of them are job booths, but we've got HPH, Kaiser, Queens, Aloha Care, Ohana Health, Rehab Hospital of the Pacific. We've got different organizations that want to hire people there. And so students can come, or recent graduates, or residents, and find out how they would look for a job. We also have a resume writing session, interview session, how to interview. We have a how to review an employment contract session. So, you know, there's a lot of opportunities there. And this is a new thing for us. We haven't done it before, but we're going to see how it goes.
Forgive my footnotes.
No, it's your show. You can do what you want.
There was a piece on the Tube last couple of days about colleges on the mainland that let you submit your interview by smartphone.
Oh.
You take a picture of yourself saying why you think you should be permitted, why you should be accepted at a given college. You email that to the college, and of course they have your grades, but they make their decision based on what they get. Never mind. It's just
interesting.
It's modern times. We're going to take a short break again. Whoops, sorry. That's Kelley Withy.
Withy, but I like worthy.
Okay, well,
I kind of like that.
I think it's implied. She's a professor of alternative medicine at John A. Burns School of Medicine. She knows everything about that, and she's organizing this
I know nothing about it. Nothing.
This fabulous event tomorrow in Waikiki at the
Hilton Hawaiian Village.
Hilton Hawaiian Village.
Coral Ballroom.
Which is good for doctors, and I suppose other people too. They can come if they want.
If they're interested in health careers, yes.
Okay. And we're going to take a short break. We'll be right back.
Aloha, welcome to ThinkTech Hawaii. My name is Josh Green. I'm the host of a program called Healthcare in Hawaii. I'm a physician. I work in the emergency department on the Big Island. I also serve in the state senate, which, please don't hold that against me, doesn't detract from my television program. We speak about all the big healthcare issues in the state. We get together on Tuesdays from 2 o'clock till 3 o'clock in the afternoon, and we try to talk about the most important issues in healthcare. This is a terrific venue for people to learn about healthcare. There are many programs on this station. We broadcast it later, not just on the internet, but also on OC16. Thanks for joining us. Please be informed healthcare consumers.
I was just at a meeting that I came from to get here about school health aid.
We're back. We're live. It's Kelley and me. Hi, Kelley.
Hi, I'm Worthy.
Kelley Withy. And we're talking about the John A. Burns School of Medicine and an event that's going to take place, a conference tomorrow in the Hilton Hawaiian Village. It's really important. So can you give us a précis, Kelley, of exactly, you know, how the track of the substantive part of this program is going to work?
Yes. So in the morning, Senator Schatz has very kindly come to welcome everybody, and Senator Green. Is going to be our MC.
What a powerhouse.
We are going to have a brief description of the shortage right now, and then we're going to have a speaker from the mainland who is an expert in direct primary care. He teaches a class on different models of care on the mainland.
Including the mystery one that you didn't want to talk about.
That's the direct primary care. That's what it's called.
Okay.
You cut out the middleman and you just Marcus Welby them.
Interesting.
And then we're going to have a panel of local docs who have innovative models, including a cardiologist who is doing a model where you make more if you save, so it's very innovative models locally. Then we're having another mainland doctor who's actually spent a fair amount of time working with organizations to become patient-centered medical homes, talking about the happiness in medicine. So how to be happy in your profession, because we're suffering a little right now. It's tough to be in medicine right now. And then in the afternoon we have 4 different tracks. One of them is training on how to teach students. One of them is how to write your resume. One is how to review contracts. We have a lawyer doing that. He might feel outnumbered there, but he's a good guy. We have one about interprofessional practice and how to create one here, because we don't have very many.
What is it?
Working with a team of providers. So when I said that Cheers, you know, you go into the
Everybody knows your
healthcare,
name.
everybody knows your name. You can't just have Marcus Welby there. You've got to have nursing staff, you know, radiology help, lab tech help, front office help, and it's easier if you work in a team, and it could be with nurse practitioners, physician assistants, you know, sharing the responsibility.
And
That's interprofessional.
Better medicine, isn't it?
Better medicine.
I mean, if you
And
had a
it's-
choice of having that or not having, you'd want to have that every
Yeah,
time.
and it lightens the load on the doctor's shoulders, and I think it makes for happier work.
Yeah, and happier patients.
Happier patients, happier docs.
But it's got to be done right.
Yes.
That's the way the light,
that's why
you don't
we're
lighten the load by,
teaching
you know, abandoning the load.
Right. So we got a session on that. We have a session on transformations in Hawaii, patient-centered medical home, Medicare changes that are coming down the line. We have a session on the direct primary care, and we have a session on accountable care organizations, clinically integrated physician networks. These are new things with the Obamacare that we're starting in Hawaii. And then we have the job fair in the afternoon. We have the creation of the book. The educators are going to do that in the morning. They're going to hear from students about what helped them along their pathway. And then they're going to review the book draft that we have. And then the afternoon we have the career fair. We actually are giving away 3 iPads by raffle if you go see all the booths.
You thought of everything.
Well, the recruitment folks thought of that. I can't take any credit for that. So we're also going to be encouraging the docs to teach more, to be on a speakers bureau where they can go out to high schools and tell people
About the
careers.
profession.
Yes.
Encourage
to get
them.
more people in.
Yeah.
We're also alerting people to the loan repayment program that we started 2 years ago with HMSA Queens and Aloha Care Support. We were hoping to get legislative funding because it's a federal grant that needs local matching.
Matching.
Dollar for dollar.
So maybe
We
Senator Green can help you on that.
You would hope. But we just got awarded $311,000. But we have only raised through private and donations from organizations.
That's where you need it from, the private side.
Well, anybody, any
Okay,
local
yeah.
money.
Yeah.
But we raised $100,000. So we can only take 100 of the federal money. There's 200 on the
Too
table.
bad. It's on the table.
It's
How
on
much
the
time
table.
do you have to match?
A year. I mean,
Okay.
as it comes in, we can use it.
Okay.
Yeah. So actually, we've started a fundraising at our website, which is AHEC, Area Health Education Center, ahec.hawaii.edu.
Okay.
We did an Indiegogo thing. You can go on and you can give $10,
Yeah.
and then your doctor gets a thank you note
Yeah.
from
Great.
you.
Great
yeah,
idea.
Yeah. Remember I said thank you, doctor?
Sure.
There you go. Done.
That's great.
So anyway.
So this is really high energy, high possibility.
Well, these are great folks. We have 16
Community
loan
things.
repayers right now, and they are wonderful, and they're
Yeah.
so happy with it, and we don't even have enough to maintain them. And we got permission to expand to social work and psychology,
Oh, good.
nurse practitioners,
It's
PAs.
understated areas, you know, you
Mhm,
need
yeah.
that in any given community. Yeah.
So we're really trying to raise this money because we think it's really worthwhile.
Good.
Worthy. It's
Knock
worthy.
wood. I hope it all comes through for you.
Me too.
So I wanted to, you know, in this part of the show, we have about 5 minutes left. It just strikes me that we always cover the, you know, the problematic side. And if I had to pick, you know, sort of a major looming problem, it's not all a problem, but part of it is the whole thing about gerontology. It's about old age medicine.
Mm-hmm.
It's about the fact that we live longer, especially in Hawaii, and to live longer, you know, quality of life depends on having physicians around to make it good. Well, I have seen in you know, people I know a number of times in the last, you know, I guess few years, they had such a terrible time finding doctors specializing in old age medicine. So where is that in your list of stats, and where is it in this conference?
We have, in our stats, it's included in primary care.
Okay.
So we need 300 more of all those types of doctors. Luckily in Hawaii, we have an excellent geriatrics fellowship program. So we have training, I believe it's 6 people a year that get trained. Unfortunately, they tend to stay on Oahu. So we will be able to find a geriatrics doctor. But neighbor islands, almost none. But this is what we're going to need more of. People who know. They're usually internal medicine doctors or family physicians who get additional training in senior needs. We need more of them.
You know, and it's one of the big problems about living in the neighbor islands. I suggest to you, you know, there is already a trend, you know, people leaving Oahu go neighbor islands.
Mm-hmm.
Life is sweeter there.
Mm-hmm.
Although there's also a trend where incomes are lower and life is economically harder there, and medicine is more problematic there. But I suggest to you that if we could solve this problem about the availability of medical care at a parity to Oahu on the neighbor islands, that trend would continue and increase. Because the neighbor islands are a sweeter place to be.
I agree.
So that's all back to the computer again.
Well, yes, and what if we required our students to do 4 months on a neighbor island?
Yes, you should do that.
Well, then we need the doctors on the neighbor island to say, yes, I'll train them. We need the communities to stand up and say, we will house them here, because that's the
On the
hardest
neighbor
thing.
islands,
Yeah.
yeah.
Kauai, Maui, almost impossible to find temporary housing.
And expensive.
And expensive. So we can pay the $250 for the round trip airfare, or we can go to Hawaiian and ask them to help us, which I would love to do. But we need on the ground support. And then if they did, you know, 10% of their medical training on a neighbor island, we could increase that class size.
Yes.
So
I'm reminded of a kid I met who went to dental school on the tab of Kamehameha schools. He'd been a Kamehameha graduate. They sent to medical school, dental school in the mainland, came back, and he had an obligation to practice dentistry on the neighbor islands. I think it's a great model to follow. You could, for example, you know, either A, you have thousands of kids who apply for those 76 seats, may I say, 75?
Not yet.
Not
There's 66,
66.
and then A.T. Stills University has the Waianae campus, which has 10 spots.
Okay.
So you could say we have 76 in the state right now.
And you could say it's a great benefit, you know, because you have all these kids applying. You have some great graduates. They're so smart,
Wonderful.
so likable, those kids. I envy you being around them, actually. But you say, you know, we're giving you great education. You don't have to go to the mainland. You can, you know, enjoy this at a relatively cheap price. We're going to extract a promise. It's a payback.
Right.
We want you to spend X years on the neighbor islands. Maybe you'll even stay, but you have a commitment. And I think that would work. I think they wouldn't have no choice about doing it. They'd have to do it.
I like it. Of course, if they got a full ride to Stanford and they didn't have a commitment, they would. But I like that idea.
Yeah, well, anyway. Are you going to speak tomorrow?
Yes, mostly on the physician workforce. But just for
Okay.
like 15 minutes.
And you thought
being
you'd come
important
down
guys.
here and talk to me even when you had all these burdens and
I
pressures?
have a lot of things to do, and
Yeah.
that's why I said I've had a sleepless week, and you always get me on this show when I look my worst, but here I am.
Kelley Withy, one of my favorite people from John A. Burns School of Medicine, forever, I think. Thank you so much for coming
Sure,
down,
my
short
pleasure.
notice, and engaging me in this very, you know, we're going to call it good fellowship kind of conversation. Thank you so much.
Sure, my pleasure.
Have a good conference tomorrow.
Thank you very much.
Aloha.
Aloha. Huh.